I gave her some thoughts before she went.
Okay.
And I'm sure she represented them.
When we did, it's funny, we came to plan questions, and me and Sean was going data layers on the large metals,
Okay.
one by one, and having discussions about what are we missing. Okay, we're going to go ahead and get started. We're running a few minutes late.
Fills up?
Yes. If we wait until the room fills up, we'll be here all afternoon. So good afternoon, everybody. It's a pleasure to be here. My name is Ann Palmer. I'm a program director at the Johns Hopkins Center for a Livable Future at the Bloomberg School of Public Health in Baltimore. And we just want to welcome you to our session this afternoon. And we have decided to forego PowerPoint presentations. The last couple of conferences I've gone to, we've actually done just that and had people talk and had the audience ask questions, and I found that it was a much richer discussion. And so instead of, especially after lunch, I think it's kind of tough to watch PowerPoint. We're going to go ahead and we have a set of questions that we've developed, but we also will invite you to ask questions. Just so you know, Daryl Harris, who is from my office, he manages the Baltimore Food and Faith Project. He was asked to be in a friend's wedding and could make it to go to the wedding when he was going to come here, and then it turns out they wanted him actually in the wedding. So he is not able to be here this afternoon, but he did write up some responses to some questions. And I will play the role of moderator and the role of Daryl when it's appropriate to contribute to the conversation. So I'm going to first, do you all know why you're here? I think in terms of the type of what the discussion is going to be focusing on. And what we would like to really talk about is our own particular work and how we see these issues. And then also just what do you want to know when you think about this type of work? And, we use these terms a lot, and I think sometimes when we talk about things like food environments and food justice and food insecurity, we're not very clear what we mean. And so I think this is an opportunity to give people a chance to ask questions about, how does that look in real life? You read it in a book, you read it in an article, what does it mean, and then how does it look and how does it play out in the work that we do? So the first thing we're going to do is just introduce ourselves and talk. I've asked everyone to just do a brief introduction and then talk about the work that they do and how they think they ended up on this panel. So I'm going to turn it over to Amanda, who's to my left.
Hi, good afternoon, everyone. My name is Amanda Behrens-Basinski, and I manage the Maryland Food System MAP project at the Center for a Livable Future. The MAP project is an attempt to geographically assess our food system here in Maryland from production to consumption. We look at everything from agriculture, inputs, environmental impacts, processing and distribution sites, and as well as food access, food security, especially in Baltimore City. And also look at those things with demographics and health impacts, trying to understand the resources we have for our food system in Maryland, and then gaps that we might have and opportunities for improving and strengthening that system. And we've developed a food desert map for Baltimore City to better understand those areas where low-income people have an especially hard time getting access to healthy food. And so I'll kind of talk about things from a geographic analysis perspective this morning.
Hi, my name is Michael J. Wilson. I'm the director of Maryland Hunger Solutions. We're a statewide nonprofit group that works to end hunger in the state of Maryland. That's our simple goal. We do that through a variety of ways, through advocacy at the federal and state level. We do that through connections, connecting folks to the federal nutrition programs, whether it's WIC, whether it's food stamps, also known as the food supplement program here in Maryland. We not only sign people up, we also train other organizations to sign people up all around the state. We work with school systems to help improve and increase school breakfast programs, school lunch programs, after-school feeding programs, summer feeding programs, Anything that can help provide food, nutrition to hungry people in the state of Maryland, that's our goal, and it's simply to eliminate hunger in the state of Maryland. We also look at nutrition and look at quality, but our major goal is to deal with nutrition, and we work with other folks all around the state to do that.
Good afternoon, everybody. My name is Laura Flam. I work at the Baltimore City Health Department, heading up what's known as the Baltimarket program. That is a suite of community-based food access programs, and those programs include the virtual supermarket program, the Neighborhood Food Advocates Initiative, and a new one that we are kicking off this January called the Healthy Stores program. Before I came to the City Health Department, I actually worked for Michael J. at Hunger Solutions, so I have a background in hunger as well.
And so anything I say incorrect, Laura will correct me.
So Daryl, who's not with us, is actually the manager of our Food and Faith project, which has been around for about 6 years. And the goal of that program is basically to work with faith-based schools and institutions that are interested in looking at how their faith informs their food practices. So it's been a very interesting project. It was started a number of years ago with a team member on our staff who had done her master's thesis on environmental justice work and the faith movement. And so from that kind of came this food component. And Daryl is, in addition to having a degree in organizational development, and he works with me on another project that I direct, Food Policy Networks, which works with food policy councils and other coalition groups in the Chesapeake area and around the country. He also is ordained Baptist minister. So he has a really amazing background for our work and be able to contribute to that. And then, let me just see here. I was going to say, we'll start out, the first question we have is to define the food environment and why are studying food environments or thinking about food environments important in terms of the work that we do. So Amanda, do you want to start?
Sure. I'll start that one, and again, talking about my experience doing this with a map and kind of trying to understand the food environment geographically. So looking at physical aspects of different neighborhoods and understanding where healthy food is available or not available. And I think it's important to look at the actual presence of healthy food because we want to be making sure that everyone has access both to affordable and healthy food. And, it doesn't, right now, we know that there's a problem where healthy food is not available in the same amounts everywhere. And so we want to understand patterns of how do those trends compare to different demographics of our society, looking at income levels and race and education levels. And are there patterns that we should be addressing from a policy level or from a program level at the city? And so it's really important to look at that kind of physical environment. And I will say, in some cases, it's not always possible to have healthy food access points everywhere, but we really want to try to make healthy food access equitable as much as we can. So it's really important to look at that geographically. There are some things that you miss when you do that, however, and I just want to quickly touch on that, is that all of the social aspects about accessing food aren't always captured in a geographic assessment. People go outside of their neighborhood. They don't go to the closest place because they're looking for better quality or better prices, or they just like the store better. Where food is very personal, and so we make choices about our food for many different reasons, and sometimes it's hard to capture that on a map. But I think you need to couple both the physical environment with these social factors as well.
So I always find this a complicated question because to define a food environment depends on your perspective. So from an academic or from a professional perspective, you can define a food environment in lots of different ways in terms of what a neighborhood has, what a neighborhood doesn't have. But from the perspective of folks who are just looking to get food, It's, do I have a neighborhood store? It's a very simple question. And so the way you define an environment is going to be different depending on your perspective. One of the things I think we all know, and one of the interview questions we always ask people is, why is there hunger in Maryland? And it's a simple one-word answer, and the answer is poverty. And so poverty is the overlayer for all of this. So when you look at a map, as Amanda was saying, you know, you can look at poverty, and that will help explain why there are no grocery stores in some areas. If the grocery store doesn't think they can be profitable there, they're not going to be there. And so that gives you a different challenge about the environment. When I think about the environment that way, it's complicated from a lot of different perspectives, but when we think about it, we have to think about how it affects not just our perspective, but other folks' perspective as well.
That's actually a perfect segue to some things that I jotted down while Amanda was talking. So when you're looking at this concept of the food environment, you know, a lot of what we're talking about is, as an individual consumer, who can access what and why. So I think that's one of the important questions, is the why. So as Michael J. mentioned, a lot of that has to do with poverty. You know, we're looking at, in some ways, simple rules of supply and demand. So we work with small corner stores through my Healthy Store program, and they say, well, I mean, we don't carry fresh fruit because nobody buys it. But then you start going back again to that why. Well, are there opportunities for working with those stores, working with the community to build the demand? We hear from the community, hey, we want fresh fruits and vegetables. So you kind of start going down these really interesting rabbit holes, and you start looking at our food system as a whole. You start looking at, well, how much does it cost, your small store to be stocking fresh fruits and vegetables? Where are people shopping and how often? Does that have something to do with how often food stamps are distributed? Does it have to do with the economies of scale at buying at a large grocery store? And then a lot of what we haven't mentioned, we've kind of skipped over a little bit, is the what then. What does it matter if there are no fruits and vegetables in your community? One of the projects that I work on at the health department is called the Virtual Supermarket Program. We actually facilitate online ordering and delivery of groceries at no cost to the customer. And one of the communities that we're working in right now is a neighborhood in Baltimore called Cherry Hill. And they're like a really interesting community because they're very kind of geographically isolated. I don't know, is anybody in here familiar with the Cherry Hill neighborhood in Baltimore? A couple, okay. So it's like over a bridge and kind of like across the way. It's closer to Baltimore County than the rest of Baltimore City in a lot of ways. And they're 2.5 miles away from the closest full-service grocery store. In the past, they had this really vibrant town center, and it was a community that was actually much more mixed in terms of income. And then you saw, at the same time that you see white flight in areas, you see black flight in areas, and all of a sudden, you have this like area that's still predominantly African American, but mostly low income. And so then when you start looking at that, what then, you start to see all of these health disparities that come from the additional time and effort and all of that to get to the grocery store.
If I could take another bite at the apple, I mean, one of the things that Laura referenced was the problem of corner stores. And so one of the provisions in the Farm Bill is going to require a different stocking requirement for stores that utilize the food stamp program in terms of fresh fruits and vegetables, in terms of variety and diversity of products. I don't think we know what that's going to look like yet, but that's going to have a real impact on those stores and for people who live in those communities, hopefully in a positive way. I mean, we don't know the answer to that yet, but that's a hopeful thing.
So I'm going to read Daryl's statement because it's a really nice segue to what you all were talking about. And he wrote, a food environment is the culture of food within a given area. But beyond that is also a thermometer through which we can measure the extent to which a community is thriving or dying. Thriving communities tend to have fresh produce and other foods that make a healthy lifestyle most likely. A community's environment provides the ingredients necessary for a thriving life and encourages residents to participate. In too many Baltimore neighborhoods, the food environment is harsh and indicates a community's demise. In such areas, processed, high sugar, and high salt foods become the dominant and almost constitutional, such that the residents learn to enjoy them, the business owners think it's the only thing that's profitable, and their removal threatens to upset the order of things. In these communities, healthy food options are rare and often appear impractical to both businesses and residents. Such an environment is the result of a myriad factors and serves as an indication of whether the overall environment is conducive for living. Which, he's a really good writer. I wish he was here. So, but that to me kind of just sums up what you all are saying, is that this is, what you see is just that's pervasive throughout the community. It's not just, you see it in the food, but you see it in all these other places as well. So when you think, we talked about the food environment, and Laura, you touched on this a little bit about what's missing from the examination. So if we only looked at food environments, what would that tell us? And what else do we need to consider when we're thinking about food environments? Whoever wants to go first.
Want to go first this time?
Actually, I was wondering if Amanda wanted to touch on, we've been talking a lot about urban food environments because so obviously the work that I do is exclusively in Baltimore. When you look at hunger in Maryland, that's all across the state. You have urban, suburban, peri-urban, whatever that means, rural. And I know that you all have been tackling a little bit of like what the food environment means in different settings, and I'd be curious to kind of,
Well, I wanted to touch on I threw out the term food desert and how that's measured differently in urban and rural, and kind of that gets at part of what's missing in how we're looking at this, and how it's so important to consider the specific qualities of different areas when you're examining it. There isn't kind of a one-size-fits-all measure that captures everything. And a lot of, like the USDA has done a food desert analysis for the whole U.S. They consider access to healthy food the presence of a supermarket. Well, yes, that is where people mostly get the bulk of their healthy food items. It's overlooking all of the other places and ways that people access food. What about, what role do the corner stores and convenience stores play? And what role do farmers markets play? And with corner stores and convenience stores, in a way, they're playing the opposite role of too much presence of unhealthy food items that are interfering with people's the choices that they're trying to make. They might be trying to eat healthy, but if you're constantly inundated with unhealthy food choices and you're hungry, you eat those things. So I think it's important to think about the scale on which you're measuring and whether that measurement is really getting at the issues that are important. So in a rural area, the USDA looks at the proximity of a supermarket to be 10 miles. Now that's a big issue for people who don't have transportation. The assumption is that in rural areas, most everyone owns a car. But that is a false assumption. And a lot of, especially in southern Maryland, there aren't good public transportation options. So when they don't own a car, they really don't have a way to get out to get food. But even so, in urban areas, they look at a mile as a good proximity. But that's a long way to walk while carrying groceries. So our food desert analysis in Baltimore City has looked at just a quarter mile, trying to acknowledge that people, if they were walking to get their groceries, wouldn't walk a very far distance to carry everything. However, we found that most people still use a car of some sort, whether that's paying for a cab or getting a ride from a friend or family member, or in Baltimore, a hack, the unlicensed cabs. So people are going out of their way to get to a grocery in a vehicle, and so thinking about the transit options are really important too. So I don't know if that touched on what you were looking for, Laura, but.
So, I mean, when you look at the environment, we obviously look at stores and corner stores and farmers markets and restaurants. What's missing from that calculation, I always say, is also schools, because most kids eat a meal or two every day during the school year, during the week at school. And so schools are also part of how you have to look at the food environment. I always say people, who here really has both a nutritionist and a cook, to take care of their food needs. And that's everybody whose kids are in school. Their kids have a nutritionist and a cook. And so focusing on healthy meals at school is a great way to deliver healthy meals to thousands of kids every day in the state of Maryland. So part of our challenge there is not just making sure that the nutrition is appropriate, and right now we're having a battle in the Congress about trying to reverse the standards. There are some who think the standards are too high and they're trying to move them back and let people opt out of them, and that's not something we think is not a good idea. At the same time, we have to deal with the cost and the affordability. And if there's one number I could have you remember from today, and one word I'd have you remember, the number would be 85%, which in Baltimore, 85% of the kids are on free and reduced meals. 85%. And so the concept and the program of community eligibility, which is a program by the USDA, which is if you have a high enough percentage of free and reduced meals, instead of collecting the forms and figuring out you're free, you're reduced, you pay full freight, and dealing with all the numbers and bureaucracy around that, if the number is high enough, everybody eats free. So for example, in Somerset County, Maryland right now, in all the elementary schools, everybody eats lunch and breakfast for free because they opted to use the community eligibility provision, which is something we're trying to get Baltimore to consider doing. There are a bunch of schools in Washington County. There are places that this really works, but Baltimore is the prime place that this really could work. And when you think about food environments, we just have to consider schools as part of that as well.
Just real quickly, I want to note that Somerset County actually has a higher obesity rate than Baltimore City. And it's a rural county in the Eastern Shore where a lot of food is grown and produced. So it's an interesting kind of conundrum, and there are some farmers that even are on food stamps as well. So just something to think about.
I guess I'll hop into the conversation on what's missing. So we're here at an environmental justice and health symposium, right? And I guess what we haven't explicitly said is, what does food access have to do with health? And we know from a number of studies that are kind of both broad-based, targeted studies that look at individual shopping patterns, studies that look at kind of overall demographics in communities, that if you don't have access to healthy food, your eating patterns are going to be less good, you're going to be more likely to be obese, which obviously has impacts on things like diabetes, heart disease, stuff like that. I come from a public health background, and so I'm not a dietitian, but I do know that eating fruits and vegetables is good for your health. And I do know that most people know that. I mean, does anybody not know that fruits and vegetables are good for your health? Okay, so at least in this room, we're a fairly educated room, but we'll assume that we're pretty good. And the problem for most Americans is not knowing that fruits and vegetables are good. The problem's knowing how to incorporate that behavior of eating fruits and vegetables into your life. So getting a little public health nerdy on you, there's a model of behavioral theory that I find is really helpful, and it's called the socio-ecological theory. And that looks at everything as kind of like these little Russian dolls, So you have each of these individual factors that are all nested inside of each other, and they all interact with each other. So you change one thing and it impacts the other thing, vice versa. So you have everything from your individual factors. So what do you know? How sure do you feel that you can eat healthy foods? You look at how much money does your household have to spend on food. You look at what are the norms and the culture around food. You look at, and then you keep stepping out and out and out. And that's when you hit into things like, what kind of food can you access in your community? And then you go even a little farther out and we look at that policy landscape. We look at, what is required of SNAP authorized retailers, and then how does that impact what's in your area, and how does that impact what you ultimately end up eating? So as soon as we start talking about food access, we're talking about this as just one very important part of this overall world of behavior change. And as soon as we talk about food access, usually somebody says, but people don't know how to eat right. And yes, that's true. We're so excited right now that there's a really strong dialogue on how the environment impacts consumption. And right now, we as kind of a field are working on like educating the general public on the fact that it's a part of all of these factors. It's not food access is the end-all be-all, and it's not nutrition education is the end-all be-all. It's that every time you're doing one thing to look at improving food access, improving food security, improving nutrition education, you need to be looking at all of those layers because that's where you're going to really see change.
So I'm going to be me for a moment, and then I'm going to read Dariel's statement. So we actually just published an article, and it was in a journal called Cafe, Culture, Agriculture, Food, and Environment. And it was low-income residents in Baltimore City and their perceptions of organic food. And the reality is they know way more about organic food than we would assume. And they value it just as much as any other income group does. But it is prohibitive in terms of cost. And so there's this, I think part of that whole mantra, they also associate it with being healthier, which in some ways it isn't, but that's also kind of across the board. It doesn't matter if you're low income or middle income, people tend to think of organic food as having, health attributes that it doesn't necessarily have, frankly. But that's in part the marketing of the organic industry has been very much around it being a healthier choice rather than being healthier for the environment, which is really the bigger benefit. So anyway, that article was a very interesting research project to be part of, but it certainly made me aware that yes, in the U.S., people do know what is healthy, as Laura said. They definitely understand that, but it is a far more complex problem to look at why are people not eating the foods that they should be eating to have good health, and then you get into all these other layers. And frankly, there are very few people in the United States of any income group that are eating the way they should, quote unquote, be eating in terms of daily, the recommended amounts. And so we shouldn't think that the problems that these are across the board and they're exacerbated in low income areas because of a lack of resources. So that was my hat, and I'm going to read Dariel's little statement. And this, just to remind you of the question, what's missing from the food environment discussion, what else needs to be considered? And he mentioned public policy, institutions of faith, and community groups. Perhaps the biggest influence to the food environment is public policy. Policies dictate what is permissible and often what is likely. Policies that limit harmful behaviors, encourage beneficial behaviors, and open room for innovation are necessary. Faith groups are ready resources to become engaged. Every week, large numbers of people gather at faith groups. Oftentimes, many of those gatherings live nearby. They can be places where gardens are grown, CSAs are dropped off, and educational activities are organized. Congregations are a gathering of people, often with similar logics and outlooks. Health messages or activities that are crafted to those audiences may have significant penetration. Lastly, community groups are formed of concerned citizens who live locally and are willing to take steps toward improving the environment. Such groups should be engaged in tackling food-related issues. And this, to me, just kind of harkens back to what we heard Fred say at lunchtime about this, what's happening in their local communities and how do you work within those communities and how do you empower those communities instead of coming to those communities and saying, here's what your problem is and this is what you need to do. So the next question, we're going to do one more, and then we're going to open it up. And if you all don't have any questions, we'll go back to our list because we have plenty of questions for ourselves. So we've touched on this a little bit, but I think it's worth revisiting. How do you three see the relationship between household food security, which is the ability of a family or a household unit to meet their needs and from a food perspective, and poverty?
Well, I think Michael J. put it perfectly when he said that poverty is the cause of hunger. People need money to buy healthy food. They need money to get to the store. They need either to access a car or pay for the gas. Or some people might ride their bike, but they need the money to have the bike. It's just the root of all of that is poverty. And then I think the other piece is this kind of the know-how, the education, the understanding of nutrition. While people know that fruits and vegetables are healthy, they might not know how to prepare them. And then beyond that, again, back to money, do they have the resources in their own kitchens to prepare these foods the right, in a healthy way, or even at all? Some families in Baltimore, don't have the right utensils or pots and pans in their kitchens to make certain things. So that's something that doesn't get talked about often. I think it's a real, it's one thing to make foods available, but then we have to think about all these other factors that come into play. And you'll see a lot of farmers markets hand out recipes because they're trying to acknowledge the fact that people may not know how to use these new fruits and vegetables they're being exposed to. So they're trying to help them with a recipe. But then the other piece is, do they even have what they need to prepare that recipe? So it really all comes back to money, and unfortunately, and I think in some ways then if that's the root cause, then we need to be addressing livable wages. So just throw that out there.
So I'm going to just touch on 3 parts of this, having to do with the relationship with food security and poverty. So first, there's this perception that poor people don't eat right, don't eat well. Look at her, she's in line buying all that unhealthy food with her food stamp benefits. When the truth is that people eat unhealthy in every part of the economic strata. It's not just poor people who are overweight and who eat unhealthy. People who are wealthy also are overweight and eat unhealthy. It's not about income, but it is about income to a certain degree, because we've learned from studies that if you would simply double the food stamp benefit, most folks eat healthier as soon as they have that opportunity. It's like we say, nobody's on an all ramen noodle diet because they love ramen noodles. It's because that's what they can afford. So when people can afford more, they do better, by and large. But everybody needs this education. All of us could learn to eat a little healthier, and all of us can do a little bit better. The other part I want to touch on this has to do with policy. So it really is about policy at the federal level, at the state level, at the local level, about how we can encourage people to do better and not just chase dollars. So there is a fight going on in the Congress even now about white potatoes. Everybody knows about the fight about white potatoes? So in WIC, in the Women's, Infants, and Children's Program, there is a basket of food that you're supposed to have healthy mothers and young kids. And NIH has updated that, so it's supposed to be even a healthier basket. But there are some in the Congress from places that have white potatoes, think Maine, think Idaho, who think white potatoes deserve to be in that basket. It doesn't have anything to do with the health about it. It doesn't have anything to do with what NIH has responded. It's about they believe white potatoes should be in the basket, and they have the votes to force white potatoes to be in that basket. When the truth is, we've learned from doing a study in Maryland that most WIC participants have had white potatoes in the last week. How do you think they had white potatoes? Absolutely. So requiring white potatoes in the basket doesn't help. It doesn't help health. It doesn't help those families, those mothers with young kids. What it does do is it lets white potato manufacturers force themselves back into that so they can sell more potatoes. So policy is a big part of this, and we can't ignore that. It's about money, and it's about money that it really impacts what people have, and it's about household food security and poverty.
I actually don't think I have anything to add to this question. I feel like you guys have been very thorough. I'll pass it over to Ann/Daryl.
So, relationship between household food security and poverty. Oh yeah, I'm going to read Daryal's, and then I'll open it up.
Darryl,
Sorry.
I didn't recognize you.
I know, sorry, Daryl. I needed a hat or some sort of, something. Food security and poverty are undeniably tied. The cheapest, most convenient foods are often unhealthy, and when you are hungry and food insecure, you're likely to make poor food choices. In parens, I always make poor food choices when I'm hungry. I agree. Don't ever go shopping hungry, right? You know that. It's sort of like a rule of thumb. The price of housing and the price of fuel definitely limit what one is willing or able to spend on groceries. I may understand that spinach is good for me, but will I spend valuable money on a food item that is low in calories and both costly and quickly perishing? If I'm impoverished and I do buy groceries, I'm likely to buy something that is filling, easily stored, and easily prepared. Fruits and leafy vegetables rarely fit that description.
One thing I've come to like saying is that people, especially when you have limited funds, they're shopping for calories, not for nutrition. And that, in their mind, that makes perfect sense because we need calories to survive. But it forces them to shop for calories instead of for nutrition.
So I'm gonna make a pitch for something we do annually called the Food Stamp Challenge. So it's living on the food stamp budget for 1 week, and we did this in October of this year. So it was $30 for the week for all the food that you consume. You will learn very quickly how it changes your behavior, and B, what you can't have, and C, things that you actually don't need. So if you're interested, you can look at Maryland Hunger Solutions, look us up on the web. Maybe you want to do the Food Stamp Challenge with us next year, or maybe not.
They do some wonderful blogs. I've read about it. I have not actually managed to get through the entire week. I've done like a day. But the blogging that people write is really very powerful. So anyway, we're going to open it up now to see if anybody has any questions. Yeah, and just go ahead. If you can talk loud, you can just do it from where your seat is.
Like the camera?
Oh, sorry, I didn't realize that. Yes, Carly, I forgot about you. Yes, if you could just walk up to the microphone, that would be great since they're recording. Yeah.
Yes, I had two questions. One was related to like pop-up gardens and promoting individuals growing their own veggies and fruits. How are you all like working with different organizations to promote that? And also, I think Laura, you touched on delivering food to different individuals. How effective has that been for your organization? So just pop-up gardens and growing your own fruits and vegetables, and then delivering food.
Gardens, and then you can talk about
Yeah, sounds
delivery.
perfect.
Okay. Well, community gardens, and I'm thinking community gardens is one way to talk about a pop-up garden. There's, in Baltimore City, it's been very interesting. We've been trying to track these to add them to our map, and they're very hard to track because they're often pop up. They just show up in a neighborhood, or they unfortunately leave that as quickly as they came. There are a couple of organizations that actually provide resources and help, provide land. In Baltimore, there's the City Farms project. So within city parks, they fence off an area, and you can apply as a resident to have a plot within there, and then you get some resources from the city. There's a Master Gardener program through Maryland Extension that also provides resources for gardeners, actually, and that's across the state. They happen to obviously work a lot more heavily in Baltimore, but they are resources throughout the state. And then it was just interesting now, there's like 4 different groups that do manage community gardens, and when I compiled all of the lists of them all, there wasn't overlap. So, and they all thought they had the full list of gardens in the city. So, but I think it's certainly, it's really important when people do have access to growing food, because it helps to teach them and it's a great educational opportunity for children to understand where food comes from. But Baltimore City is really undertaking a lot of initiatives to promote urban agriculture. They have an Adopt a Lot program where it's not necessarily for growing food, but a lot of people are choosing to do that with those gardens. So they're making space available for people to use. And then also kind of sanctioning the urban farms that have showed up. And I would say urban farms, the difference I'm making between community garden and urban farm is that a garden is growing for personal consumption and a farm is growing for sale. And most of I would say all of the farms in Baltimore City are selling to many places, but they all make sure to sell to their surrounding neighborhoods where they're located as well. It's part of their mission to do so.
All right, I guess I can tackle grocery delivery. So I'm actually going to start with a little bit of history about the virtual supermarket program. So this program began about 5 years ago, and the goal of the virtual supermarket program was to promote access to healthy, affordable food, And also to assess the viability of online grocery ordering and delivery as a way to address food access. You look in areas that don't have a grocery store, and they may not have zoning that would accommodate a grocery store. They may not have a parcel of land large enough to accommodate a grocery store. Unfortunately, when the grocers look around and do an assessment of economic viability, they may decide that that area is not viable for a full-service grocery store. So we said, all right, well, we have these grocery stores that will deliver food to you, rather than getting a grocery store into the community, why not deliver it to the community? So one of the things that makes this program innovative, that hopefully will make it no longer innovative, is that we're able to accept food stamps. So, and this goes back to, we've touched on different, policy barriers, policy changes that could greatly impact food access. And this is one that we're really excited is changing. So currently, this is a little convoluted, so stick with me. If I am paying for my food with food stamps, I need to receive my food at the same time that I'm paying for it. So think about the last time you bought anything online, you typed in your credit card information and it bills your account, and then, like 2-3 days later it arrives on your doorstep. So that makes your online purchases with food stamps impossible according to those regulations. So the way that our program works is we are really kind of a bridge between communities and grocers, in that we say, hey, grocer, in order to serve a low-income community, because typically the people that use online are like, six-figure income, often maybe a busy or like high-powered stay-at-home mom or very busy working mom who's like, all right, we're gonna get these groceries delivered, and they have the disposable income for that. So we're like, all right, you need to accept food stamps, you need to accept cash because cash is very important, and we'll work with the community to build some of that familiarity and comfort with using the computer to order groceries. So the way that we have accommodated this is we actually have customers pay for their orders at the point of delivery. So they bring one of those same terminals that you'll see maybe at farmers markets for using with debit, credit, EBT, and that's how they're able to accept payment via food stamps. So that's something that has been kind of at the core of making the virtual supermarket tick, is because we don't want this to be an innovative program. We want anybody who has access to a computer to be able to order their groceries and have them delivered to their doorstep regardless of how they're paying. So in the most recent Farm Bill, we actually successfully advocated for a part to be written in there to allow a pilot of online acceptance of SNAP. So hopefully we'll see, a little bit of change in that area. As far as successes of the program's evolved a lot. As I mentioned, we are kind of a bridge between the grocer and the community. So on the grocer side, some of those really important innovations were around making sure that they can accept SNAP, that they can accept cash. On the community side, we've discovered that this program, at least the way we run it, is most effective when we're working with a low-income senior population. There's a high demand there. Especially in Baltimore, we have low-income senior housing that are apartments. So you have this very compact, well-defined community, and people that are even more impacted by lack of food access than younger populations, because you're more likely to be disabled. In fact, you're more likely to have diet-specific health needs. So, I have diabetes. I need to eat more fruits and vegetables. And one thing that's been most impactful about, the way we've kind of evolved our model is we actually train community residents to be the ones that are placing orders and facilitating that delivery.
So if I can touch on just 3 parts of this, really simply. One of the things you can actually purchase with your food stamps is seeds. You want to buy seeds to grow in your garden. That's permitted. Secondly, we worked, Laura will know this as well as anyone, with the farmers markets around the state so that people could have double bucks to be able to have more opportunity to purchase fresh fruits and vegetables if you were on food stamps or if you were on WIC. And so that program is transitioned. It's now being run by the Maryland Farmers Markets Association. But there is a program called Maryland Money, so you can double your expenditures at a farmer's market to buy fresh fruits and vegetables. And thirdly, a program that's like the delivery program in Baltimore, but which is different, is the program they had in Howard County earlier this year. It was a pilot program, and they're still looking at the analysis to see if they can continue to do it. It was called the Roving Radish. And so the Roving Radish actually took pre-set meals. It was pre-cut with directions and with recipes, and people could purchase those meals ahead of time, and it had different delivery stops all around the county. And it was innovative in that they were trying to appeal both to people who could afford to buy these meals and people who may not be able to, so they subsidized it. And they were really trying to get a mix of both populations, because it was really meant to be a service that provided quality and provided something easier for folks, as well as for folks to make it affordable. And so we're hopeful that something like the Roving Radish is going to survive in Howard County, but that programs like that you can share the best practices in other places around the state as well.
I was just going to say, we actually evaluated the Roving Radish project, and we just looked at the data last week because we're doing a presentation on Wednesday, the last day of the meeting, and the data looked really good. And they had to have, I think it was half could be subsidized and half would be paying the full price, which was $25 a week for 2 meals for a family of 4. So if you were subsidized, you were paying half that amount. And if they keep it at that threshold, they don't lose money.
Right.
So that was, and we've got great comments and great feedback, and we're still looking at it. It was very exciting to see that happen.
Everything but the name.
Yeah. Yeah. Can you come up to sorry, because they're trying to record. Thank you.
Walking is not my forte.
We got time.
Thank you for getting up.
One of the observations that I've made over time, especially now, because all of a sudden there is a concern about how do we provide food or having access. First of all, when I hear the terms food security, a lot of things pop up in my mind. What happens to the food in catastrophic situations, which you don't even hear being addressed? In emergency planning, where's the food? But what even concerns me more is the lack of understanding of new food delivery systems and their possible role in addressing food access. Example, if you scale down an aquaponic situation, you can place that in the neighborhood of the people that you're trying to deliver food and allow them to become owner-operators, which will address the economic concerns of poverty. See, to me, we got this still, how can we help the farmer? Why not let the individuals that you're trying to deliver the food to become your urban farmers? And that's contingent upon understanding where the current science is in terms of delivering other systems, such as controlled environment agriculture. Secondly, it will address the food to school program. If you add your greenhouses to your schools, automatically upgrade your science program as a result of that. But you have your food right there at the source. So in terms of the policy makers, they may not have the necessary information to deliver good policy.
Thank you for that. Some really powerful statements in there. And I just want to touch on just the national farm to school movement that is trying to both get local food, more local regional foods into schools, but that requires a lot of changes in the large commercial distribution systems, and one of the things they're doing in the meantime is making sure there's gardens at the schools, growing things and teaching kids about how to grow food, and finding that those children take that home to their parents and their parents are interested. So I think there's the empowerment piece of teaching people to garden is really huge. It's important, and I think it's in some ways the amount of food that someone can produce, say at a community garden, might not be able to meet all of their food needs, but it empowers them to take more ownership of providing for their own food needs, and that's an important piece to consider as well. So I just wanted to add that. I don't know if you guys had any.
Not really. I mean, I think the school garden piece is important, and it's growing in lots of places. There aren't as many places that are doing aquaponics, but there are places that are doing school gardens, and the impact that it has on those kids and their willingness to eat something that they haven't tried before because they've grown it is incalculable. It's different trying to get some of those same products into the school system because the requirements of USDA and the inspections and all the things that have to come when you're actually serving food to kids in the school lunch and school breakfast programs is a different standard. But I think, having the kids learn how to do this is important, both for health and nutrition reasons as well as for science and industry reasons. So.
I can comment a little bit on the aquaponics piece because I share an office with our aquaponics person in the center who's just done actually a national survey of all the aquaponics projects around the country. And we have a small project at Sloburn Arboretum in Baltimore, which is part of the park system. And one of the problems with the more kind of controlled environments is the cost of operating them. So they're very energy intensive at that scale. So what it costs for them to run the aquaponics project at Silburn is 10 times what they actually yield in terms of the amount of fish grown. So, and what Dave found in the survey, his name is David Love, the gentleman the professor who did this study, was that most of the people were doing this at the household level, but it required a lot of inputs. And so I think what I've understood from his work and what he's looked at, like the University of Maryland system that's up in the Inner Harbor, is that there's a certain scale that's required where it would have to be the tipping point that you would start to not lose money. And I think that's true for a lot of like the urban agriculture projects that we see, is that these can augment people's income and they can augment their diets, but I don't think we have models right now where people are making a living. And I feel like we need to be honest about that. So when we've got a lot of people investing in what we would consider more alternative systems, we have to be really clear on what we're asking them to do and what is the resources required to doing that. Because if we don't do that, you can make a fairly large commitment to something and then, all of a sudden you're losing money because this is not, the business, the math didn't work, right? The cost of energy can be a huge, barrier for a lot of those folks. So we have projects in Baltimore City. We have a lot of urban farms and a lot of them are doing that, but I would say by and large, most of them have, said it's not a moneymaker. I mean, it is more about the education, it's the empowering, it's like starting to do those activities, but is it going to be a viable source of income for folks over a 12-month period? It really slows down in the winter when they're growing. We've got lots of hoop houses in Baltimore City. It hasn't proven to be that yet. So I think that there are the projects that I think are most successful do about half of soft money, foundation dollars, and about half is income generation.
Let me touch on one other part he raised, which is about the emergency food. So when Hurricane Sandy hit and had an impact on Maryland, one of the provisions in the Food Stamp Act is that people can get access to emergency food. And so we helped to make sure people got emergency food, additional food stamp benefits in the southern part of the state, on the eastern shore, on the western part of the state, all the places that were impacted that had emergency needs because of Hurricane Sandy. So there are provisions which are supposed to help in that case. One of the issues we've also found is that if there's a weather situation and it's a lot of snow and people can't get to utilize their benefits, or their food spoils for some reason because of weather situations. Their electricity goes out and they don't have their refrigerator, can't maintain cold. People can get those things replaced. And we've been working with DHR to make sure that people know about that and that people can get those replacements whenever necessary.
But what about supply chain and not just people who receive subsidized benefits?
Right.
I think that was a part of his question. What if we had a terror strike and vehicles could not get foods to communities, period?
Right.
What do we do?
I think part of it is that we haven't had to face that issue yet in the U.S. to the extent, we have in certain specific communities, but
Natural disasters.
yeah.
But not.
And so I just want to mention real quickly, and I don't know, Laura, if you have something to add to this, but I wanted to mention that Baltimore City is working on a resiliency plan that spans many, many issues, but they're trying to develop a food resiliency plan as well, and looking at even the Jessup Market Terminal, where most of the food comes into Maryland. How does that, if something happened to that, where would the state be left off? Where would the city? And they were looking for examples in other areas and found that we haven't had disasters that lasted more than, say, 3 days, and that there is enough food, there tends to be enough food to get us through those 3 days. And so these beyond...
7 days, I think it
Is
was.
it 7?
I think it's 7 days.
Beyond that, however, we haven't really been faced with situations like a drought in another country that you might see overseas. But in the U.S., we have a lot of, I think part of it is that we rely so much on packaged foods that last a little bit longer. And so, but at the same time, those aren't necessarily the healthy foods that we should be eating, but it's calories to get people through a crisis. But it was very interesting. I'm just bringing this up to say both that Baltimore is trying to look at this in a new way, and we found that there weren't a lot of good examples out there. So it's something that I think we're grappling with and trying to see if we can figure out what a good plan would look like that would make a lot of sense.
I guess I'm kind of concerned with the alignment of federal policy in terms of what the federal policy is promoting versus what the states or municipalities are doing. It seems like there's no consistency in alignment.
No, you're right, there isn't.
And I was just recently at another conference on the Eastern Shore, and there was this focus on how we need to focus on exports so that farmers can make more money. And I thought, well, if we come into a situation and that we need to rely on our own resources, but our whole system is set up to export food, we're going to be in a bad place. So I think you have a very good point, and it's something actually the center's trying to look at to figure out how to, I think, with food policy councils.
Yeah, it is. You're right, there is not an alignment. We've looked, and it really does seem like that's a big gap. And that people don't, because they don't know what to do about it, they don't really want to talk about it much. You can't get people to focus on it.
Laura had something to add to that.
Oh, I just wanted to respond to the comment about leadership development and skills training. When we were talking earlier about, why is food access an issue and why do we see inequities and injustices in food access, we said the issue is poverty. And one thing that I firmly believe is that anytime we're looking then at changing the food system and increasing food access, we need to be asking ourselves in a very intentional way, what are we doing to build leadership, to build power, to build job skills so that we can address those systemic inequities and address that poverty. And that's something that I hope we hear echoed throughout this whole day, because whether you're talking about food access or you're talking about talking about fracking or whatever else. You know, you need to be asking, what can we be doing to make sure that we are building up power within communities to address not just food, but, you know, to address any of these other inequities that you see in health or environmental justice. So, thank you.
Should we just like phone the line?
Sure, go ahead.
I just had a quick comment and a few questions. First, I wanted to draw attention to Eco City Farms here in Prince George's County. And they were established in Edmonston to address the food desert issue. But I just recently found out that they have a master composters program, which aims at helping folks establish farms in communities that don't have access to food. So that was something I was looking into. But I have two quick questions. And through working with Eco City Farms, I've learned of this term called food swamps. And I'm just wondering, you know, what you define food swamps as versus food deserts. And then secondly, how and if you guys are working with food banks, because ideally or usually they accept donations that are non-perishable, highly processed foods, and I'm wondering how you address the issue of them getting access to healthy fruits and vegetables since they are perishable.
I'll just first address the food swamp question, and it's something, so I think it kind of came about because there's frustration with the term food desert, that it doesn't quite hit the mark. It's powerful in some ways in that it kind of conveys this quick idea that there's no food. But, you know, I think we all understand that in some rural areas it does in fact mean no food. More often the case is that there's no healthy food. And so the food swamp term arose to identify those areas that were, you know, overwhelmed with unhealthy options. And in Baltimore, we actually took our food desert map and overlaid corner stores, convenience stores, and carry-out restaurants and fast food, and looked at at the areas that those were concentrated. And they're the same areas that we're calling food deserts, which is what, you know, I think that's where I often now when I talk about these, I try to talk about them together, because I think alone, one of them, they don't explain everything, but there isn't, like food deserts, there isn't kind of a set definition for food swamps, but it's just the idea of too many unhealthy options.
So first of all, Eco City Farms, of course, is a great partner for Prince George's County, and in fact, Margaret, who runs Eco City Farms, is on the Prince George's County Food Equity Council with us and with others, working on food equity issues here in Prince George's County. Related to food swamps, one of the things the FEC has done is they've looked and they've mapped, with your help, how many more fast food restaurants there are on the inside of the Beltway portion of Prince George's County versus the part of the Beltway that's just outside of the Beltway. So there are more fast food restaurants there than on the outside, and I think there are reasons for that. And I think we need to look at that, and that's one of the challenges that the Food Equity Council has, but also the Prince George's County has. In terms of the food banks, there are a lot of different reasons why food banks accept what they accept and why they are increasingly not accepting other products. So whether it's the Maryland Food Bank, the Southern Maryland Food Bank, the Capital Area Food Bank, or MANA in Montgomery County, they're all trying to, when they can, get more fresh fruits and vegetables, whether they have to purchase them or whether they have to be more adroit at getting them from grocery stores that are donating them. And so, for example, I know, because I was at MANA more recently, that they do a great job of, when they get fresh fruit and some vegetables in, of getting them out relatively quickly so that people can actually use them before they spoil. So the food banks take what they get, a lot of canned, a lot of processed foods, because that's what people donate, and that's often what a lot of stores and others donate to them. But they are focused on trying to increase that healthy, fresh fruits and vegetables wherever they can. The other part, because while we're not a food bank, we work with the food banks. Food banks are great for emergency food assistance. When you need food today, because you don't have any food, food bank is what you're going to have to be able to do, and they do a great job as best they can to try to provide for folks.
I'm just going to say our Food and Faith Project actually has a small garden grant program, and so a number of churches do have gardens, and a lot of them choose to donate that food to the local food banks in those areas. So there's just a story about that in the Baltimore Sun.
And the Maryland Food Bank now has a Farms to Food Bank program. A coordinator, Amy Cawley, actually goes and works with farmers to organize gleaning, where the farmer has already harvested the bulk of their saleable produce, and then actually it's been interesting that they often work with corrections, so they'll have inmates that are on pre-release, and they come, and so they're not having to pay for the labor to harvest that produce, and then the food bank can then use it. So I think, again, there's many efforts underway to get more fresh foods into food banks.
Both of you, just right there, said something that I was going to talk about. So I work for the Interfaith Partners for the Chesapeake and Congregational Outreach Coordinator. So kind of piggybacking off of what he said, not only the schools being within the centers of these communities, there's lots of churches that are in the centers of them too. And in my community outreach work that I do, a lot of our churches are interested in having gardens of some kind and are either donating that food to churches, to soup kitchens or that sort of thing. So there's definitely lots of opportunity there to work on the empowerment issue, to keep it within their community rather than donating outside of their communities, if we can do that. So I wanted to just touch on that. And I live in Howard County, and I run a couple of community-supported agriculture programs where our farmer is very generous. He donates a share for every 10 or 15 shares we sell, and then we work with the school system to identify families that are food insecure, and seniors as well. And the food goes through a program called Food on the 15th, so the food goes to people who need it. So I'm aware of, in Howard County, I know everyone, we're, very wealthy county, but there's poverty in Howard County too. It has a different face than it may have in the inner city Baltimore, but it's still there. So, our poor people may have cars, but doesn't mean that there's healthy food in those children's homes. Looking at that, having just come from a meeting where our wellness policy has been, it's based on the federal policy, whatever. So they actually brought what is a breakfast for our farm kids to this meeting, and it was at a PTA meeting, distributed them out onto the table so that we could see. And the controversy was, we just came off of Halloween and how different principals weren't letting us bring cupcakes and cookies the one time a year, or 2 times a year for Halloween and Valentine's Day, when our farm students are getting cookies in their breakfast every morning. And they're getting strawberry milk that has as much sugar in it as a Hershey bar. So I was a little concerned when you said you don't focus that much on the nutrition of that. When we're starting with them, they're in kindergarten, they're growing up eating that food because it fills their bellies, but it's not really nutrition. It is that setting them up for the diabetes and the hypertension and all of that. So if you could talk about that a little bit.
Right, so let me talk about a couple of things. I'm glad somebody was here from Howard County. So the flavored milk is supposed to go away under the new nutritional guidelines. They only can do milk but not flavored milk. So that's not going to stay unless the Congress, in their infinite wisdom, lets it remain. So flavored milk is going to go away, and they're also not going to be able to do fruits. They're going to have to do fruit and not fruit juices. So there are a lot of changes that are coming, which are going to be better. I can't speak to cookies for breakfast. I can't imagine cookies for breakfast. That's beyond my recognition. But you're also right about Howard County having poverty. In fact, Howard County now has a school under using the community eligibility provision, a single school that qualifies, and so they're going to be able to have free meals at that school. I'm trying to remember which school it was. Sorry?
Stevens Forest?
I think it might have been Stevens Forest. So yeah, but so there's a school, and there is poverty in Howard County, and the food bank in Howard County, which is run by the Community Action Agencies, open a couple of days a week, and we've been there to sign people up for food stamps. There's really a need in Howard County.
You have to have a party get there.
Yes, you do. Yes, you do. And they're only open a couple of days. because they don't have the ability to do more, and that's part of the challenge they face as well.
It just reminded me that when we've been looking at income, we often use the federal poverty level, and 185% of that, which is where folks start qualifying for benefits, and that's really, even that is still hardly making it. And so there's been another study by the Center for Women's Welfare Research that conducted a self-sufficiency study, and we're looking at what it really takes to, for the cost of living, and they did analyses by different counties throughout the state of Maryland. And Howard County was, actually what they came up was at $78,000 for a family of 4. Now, 185% of the federal poverty level, though, is $40,000. So I was just thinking about having to understand the constraints or the unique quality of different neighborhoods and how that changes the picture of it.
Right. So
We're
even
trying to give food from the farmer to our custodial staff at our schools for
Right.
Thanksgiving because they're not making enough money to put food on their table.
that's right. So custodial staff and teachers, if you have a family of 4, may or may not qualify. So 2 more things really quickly I wanted to mention, because we had talked on this before. The Southern Maryland Food Bank, we had a conference call earlier this week. We were talking to folks around the state about their advocacy agendas for Annapolis, and the Southern Maryland Food Bank wants to talk about having a tax credit for farmers who make contributions to food banks and others. So we're in conversations about that. There's a financial cost there, and as we all know, the new governor doesn't want to spend any more money. So we'll deal with that at the appropriate time.
We have time for one more question. Go ahead.
Hi, I have a comment and a question. I'll try to keep them brief. The gentleman who asked 2 questions ago about emergency preparedness raised an issue about aquaponic farming and the like. And just in general, we tend to be very incremental and conservative when it comes to addressing poverty, yet we still have farm subsidies that make absolutely no rational economic sense. We still give money to people, not people, companies, not to grow stuff, yet we can't feed people who are hungry. And as he passed me, I whispered to him, I said, the poor don't have lobbyists, farmers do.
Yeah.
That's the bottom line of that. So my question is to Mr. Wilson about, you were talking earlier about obesity and poor eating habits existing throughout all economic strata.
Right.
And I would posit, I have no academic research behind it, but my guess would be that if you control for socioeconomic status of origin, you would get some different results. Meaning if you grew up poor, but you're middle class or upper middle class, you still have some of your habits that are ingrained from your upbringing. But if you grew up wealthy, you're not eating Scrapple. You're not eating ramen. You don't have some of the, you had different habits in your upbringing that exist in your current state. So if you look at wealthy people, they are not overwhelmingly obese. So obesity and poverty do have a high correlation, so we can't sanitize that. And we just heard an excellent keynote address. We really like to sanitize our conversations, race from our conversations. But race is inextricably tied to socioeconomic status. Always has been in this country. And we just cannot whitewash our conversations and expect them to be productive.
So, let me see. There's a lot there, and nothing there I disagree with. The part of the challenge that we deal with is the way we look at other people, and when you're wealthy, you can get away with a lot of other stuff because it's your money. But the perception of some people who want to put stigma on other people because you're buying that food with my tax dollars and you shouldn't be doing that is a whole nother way that we look at other people. And so it's the stigma that people think that they can put on other people because that's their right, which I don't agree with, but that's part of what happens. And part of what I was trying to communicate, maybe not as well as I could have, was that everybody has problems, everybody has issues, and to pick on poorer people because of that perception isn't fair.
And I would just add to that, I think that part of it is, talking about food swamps, that unhealthy food is just prevalent in our society, everywhere. So many people are making unhealthy food choices every day, but the constraints of poverty exacerbate that situation. So.
And, when you're talking about like where does it exist more, so I heard a health economist talk a couple years ago, and he starts his talk off by saying, what's the fastest growing sector, economically of obesity, and it's not the low income. It is the upper middle class is they're getting much faster, in terms of the rate of obesity increasing. But it goes back to, it's like this looking at health disparities. You can become, you can make everybody worse, which then, decreases it. So it's like, that's not necessarily what you're looking for. It's not the trend, but it is. I was shocked to hear that because I had never heard that, but I don't know. That's a really interesting research question to say, where did you start out from? Because I've never seen that, and that would be fascinating to look at. What is it that's, is it going that far back?
Yeah, and I'm not going to be able to quote any studies, but something that I have just on the very surface looked at just on a kind of personal interest level is, we've been talking about the environment and how that impacts your health. But one thing that is kind of this growing body of research is the impact of stress on health, which is a whole nother way that your environment impacts your health. And studies are continuing to come out that say, especially in your early childhood years, if you are in a stressful environment, if you have all of those physical reactions to stress running through your body, that's actually going to predispose you to obesity later in life, which is something that, it's a whole other can of worms. We don't have time to get into all of that today. But I would say absolutely yes, and that's another one of those reasons why, when we're talking about environmental justice, health justice, all of that, we need to be looking at ways to make our society more just, because even just being in that unjust society where people are not treated equally, fairly, and you are in a more stressful situation than somebody else, that's impacting your health.
So I just want to thank my panelists for coming today, and thanks to all of you for attending our session and for a little oversight.